Thanks, Ken, and thanks to all of you that have participated in today's event. It is truly an honor for me to be able to talk about the PHASE program and about social determinants of health with you. So social determinants of health are defined as the conditions in which we are born and live that affect a wide range of health and quality of life outcomes. These include things like affordable housing, access to education, availability of food, and a safe living environment. For example, children who experience limited access to healthy foods are more likely to have academic difficulties, to experience anxiety and depression, to be hospitalized, or even to develop chronic diseases such as diabetes and heart disease.
At Donny Pediatric Center, over 75% of our patients live in low-income households. Many of them are experiencing housing difficulties of their own, or they may live in food deserts. We've done anonymous waiting room surveys in our clinic, and they've shown that in the past year, more than half of our patients have worried at some point about where their next meal was going to come from. Thankfully, we've received a generous grant funded by the Missouri Foundation for Health, which is led by Dr. Ellen Barnage from St. Louis University College for Public Health and Social Justice. And we now have a program to address these needs in the clinical setting. It's called PHASE, Promoting Health and Social Equity.
We've been able to develop relationships with over 160 families in PHASE, and we've been able to assist hundreds of other families in the clinic with those immediate resource needs while they're there. We've been able to give away 1,000 meal kits, which usually feeds a family of 4, which has always been so receptive to the families. And we've been able to give away thousands of diapers to those families who are needing that basic needs, because quite honestly, diapers can become very costly. And we've noticed that families that are enrolled in the PHASE program at least a year are on track to meet those vaccinations versus other families who may not be enrolled in our program. And one other bright spot, because we have been able to train 30 graduate students, we are empowering a new generation of healthcare providers to understand that they must treat their families in a holistic manner while understanding and respecting the social needs of their families. So simply put, PHASE is important because our communities matter.
Without a new source of funding, we will no longer be able to support the role of a PHASE coordinator, to provide meals, diapers, infant supplies, and long-term resource connections to families. The PHASE program will no longer be able to train the next generation of thoughtful physicians who specifically address the environments in which children are born and raised. I believe the PHASE program is a great example of the type of compassionate care for vulnerable families that makes the Donny Pediatric Center truly a special place. I hope that many of you will be able to support the PHASE program and join us in making an impact, not only at Donny Pediatrics, not only at Cardinal Glennon, but for families throughout the St. Louis community. We are so grateful to each of you for your support.